Hello, my name is Kellen Beecham. I'm the insurance manager here at Duke. First off, I want to congratulate you on being accepted into Duke University. Today, I'm going to answer any questions you have regarding the student health insurance plan, how the plan works, and any cost. I look forward to your questions.
Hi, my name is Joy Holder. I'm the Immunizations Compliance Coordinator, and I'm just here to answer any questions that you may have about your immunizations, how to submit them, and any other immunization questions.
Also, we have our nurse manager, Susan Kriskowski, will be joining us. First question is dental covered. On the student insurance plan, we do not offer a dental coverage, but we do have local dental providers that will offer discounts to Duke University students.
The next question is, what about the online form if I can't meet the requirement? I believe you're talking about the EMF forms. We would like you to fill them out the best of your ability, meaning whatever immunization records you do have, please enter them into the EMF forms. Then email your immunization records to immunizationrecords@dm.duke.edu before June 15th. And then we will go through and check and validate all of your immunizations. Can you take vaccines at Duke? Any immunizations that you're unable to get in your home country or at home, you'll be able to get them when you arrive here at Duke. Rather, if you're a graduate student, it would be during the International Student Orientation, and your program will let you know the day and the time that you should arrive.
Next question. I'll enter the US as a J1 student on July 26th. When does Duke Health Insurance start to cover me? Duke Health Insurance is active as of August 1st. If you are a Fuqua MBA student, then you are eligible to enroll in the Duke Insurance plan with a July 1st effective date. If what you can do is also, if you are an MBA student over at Fuqua, you can send an email to insurance@studentaffairs.duke.edu. Please include your Duke Unique ID number, and then we can go ahead and get you enrolled prior to your arrival here. Do I need to buy traveler's insurance before arrival? If so, how long? There's no need to buy traveler's insurance. And it really depends on when you're going to arrive. I'm not sure if it's going to be that July 26th date, but if you're not an MBA student, your policy will begin August 1st. So it's really up to you, and how you feel about purchasing travel insurance is not required. I don't mind buying insurance, but I'm worried. The next question is, I don't mind buying an insurance, but I'm worried it might fail to conform to health insurance requirements for J1 status students. So if you hold a F1 or J1 visa, you are required to enroll in Duke Student Health Plan. So my advice to you is, please don't purchase any outside insurance. Okay. Next question. I am an international J1 student. What options do I have for my J2 spouse? As far as your spouse, I'm assuming you're speaking of insurance and not immunization. You can add your spouse to the Duke insurance plan. Okay, so once you're enrolled, you would contact the phone number on the back of your insurance card, the customer service number, prior to August 30th, and add your spouse at that time. If your spouse is not going to arrive at the same time you do, once your spouse arrives in the US, you have 30 days from the date of arrival, and they're going to base that on the plane ticket. So 30 days from that date, you can add your spouse to the plan. The effective date will be the date that you contact Blue Cross and Blue Shield. So for example, if your spouse arrives October 1st and you don't contact Blue Cross until October 15th, the effective date for your spouse will be October 15th.
Next question is, what if I'm unable to complete all the shots requirements before June 15th? I.e., some shots like hepatitis B require 6 months in between. Do I still email the form signed by my doctor before June 15th? So first of all, please submit all your immunization documentation or records to immunizationrecords@dm.duke.edu prior to June 15th. And any immunizations that you're in the process of getting, you can email them to that same website or that same email after June 15th, and then we will update your records and your status in ACEs. And can I complete the remaining shots done at Duke? Yes. So if you're still in process of getting your immunizations and you weren't able to get them at home, you're able to get them when you arrive here at Duke. Your program will let you know the date and the time. Every time I've tried to okay. Every time I have tried to log in on the Student Health Gateway, the web page says patient not found. We apologize, but we are unable to locate your record. Please contact the health center. What shall I do? Our system is updated once a week on Monday night. So please try again next Tuesday. So if you, for example, tried today and you weren't able to get in, please just try again on Tuesday. I still have not done the TDAP booster, but I have scheduled it for July 18th. Shall I complete the form with this date for now? And how shall I prove afterwards that I have done it? So I encourage you to submit all your immunization records prior to June 15th. And then once you get the TDAP booster, submit that separately to immunizationrecords@dm.duke.edu, and we'll update your records. I am taking just one class per semester in the graduate school. Will I need to submit proof of immunizations and health insurance?
With that question, it's kind of a tricky question. The only way I can answer that at this time is when the bursar account is generated, if you've been charged a health fee, then you will be eligible to enroll in the health insurance, the student health insurance. If you hold a F1 or J1 visa, regardless if there's a health fee, you will be eligible to enroll in the Duke insurance plan.
The next question is, what kinds of vaccine has to be completed in China? Can I get vaccinated after I arrive US? My answer to that is you get all the immunization records that you have from China, and please submit them prior to June 15th. And we'll process your records and let you know what other immunizations that you may need. Then, if there's any immunizations that you're unable to receive in your home country, you can get them when you come here to Duke.
Next question. Does your student insurance cover vaccinations and eye and dental care? If so, what's the limit of coverage? So the student insurance plan does not cover dental, but again, we do have area dentists that we actually refer the students to, and most of the students go there. So once you get here on campus, if you can just email us at insurance@studentaffairs.duke.edu and just let me know that you need a dentist and who we can refer you to, we'll go ahead and communicate that information to you. Also, as far as eye coverage, the routine eye exam is covered on the student health insurance plan. There's also a $100 reimbursement for frames, lenses, and contacts. So once you get your routine eye exam, you're going to get a receipt. Once you get your frames, lenses, and contacts, you're going to get a receipt also. So both of those receipts have to be submitted along with the claim form for you to be reimbursed the $100, if you have this Duke student plan. Also, I want to add on to that, once you arrive in the States, please update your address on ACES to your US base address. So typically, I'm assuming you'll get an address in Durham. So please be sure to update that. That's where all your reimbursement checks and all communications from insurance companies are going to go to the to the address that's listed on ACES. So as soon as you know your US address, please update that in ACES. Next question. When will international graduate students get the medical insurance so they could take TB testing with it? The student insurance is effective August 1st. So that's going to be the effective date for the medical, the graduate students.
The next question is, what's a T-spot vaccine and what is it? Why is it required? A T-spot is actually a blood test that we use to check to see if anybody has tuberculosis. Usually we use this for students that have had a previous positive PPD. Also, we use it for students that have history of BCG. So it is required in place of the skin test for students that have had BCG.
Next question. As
Oh,
far
excuse me for 1 second. Hi, it's Susan, the nurse manager. I just want to let you all know that there's a $7 fee for the T-spot that will be charged to your bursar's account. Now, about $50 of that will be reimbursed once you've submitted the insurance information, which we'll give you on the day that we have the T-spot drawn. Thank you.
next question. As far as I can understand, as an international graduate student, I have a health insurance. What are the options for my spouse if I would like to bring her with me? Once you arrive in the States and if you hold a F1 or J1 visa, you will automatically be enrolled in the Duke Student Insurance Plan. The effective date will be August 1st. You have until August 30th to add your spouse. The website you can go to after July 15th is www.bcbsnc.com/Duke. And once you arrive at that website, you can go to the benefits and it'll actually say, would you like to add a dependent? At that time, you can complete the information, the requested information, and your spouse will be added with an August 1st effective date. Duke does not handle any type of dependent coverage. So any questions you have regarding dependent coverage, the cost, please contact Student Blue, also known as Blue Cross and Blue Shield. Please contact them directly once you arrive in the States. Next question, where exactly do I go to waive insurance? It says to waive it through my ACES account, but I can't find where to do that. I'll actually email communications out probably within the next 2 days with the instructions to waive the insurance. It's a 3-step process. You're going to be able to access ACES on June 15th to go ahead and waive. So the instructions, you should receive the instructions no later than Monday. So just look forward to that in your email.
Where exactly do I upload my immunization forms? It's said to upload them online, but I can't find where to do that. So first of all, you'll need to go to the student gateway on our student health website and click on the red heart and log in, and you can fill in your HIPAA forms, the consent for treatment, and also there's a section for you to fill out the immunizations electronically. Then once you have completed that, please email your immunization records to immunizationrecords@dm.duke.edu, and you'll get an automatic response stating that we have received your immunizations, and please allow 3 to 4 weeks for processing. Let's see. Can my doctor mail my forms in order? Do they have to be scanned and emailed in? Your doctor can mail your immunization records into us. We prefer that you email them. So if you get them in hand, scan them or take a picture with your phone and send them as an attachment in your email. This way, when you send it to immunizationrecords@dm.duke.edu, you'll get an automatic response, and please allow 3 to 4 weeks for processing, and we'll let you know if there's anything else that you need.
Next question, do we need to pay for the vaccines taken at Duke? If so, how much approximately? The vaccines, it's kind of a catch-22. If you get your T-spot at Duke, which I think that's a requirement, then there is a $70 charge that will be placed on your bursar's account. You will be reimbursed 80% of that once you get the receipt and you submit the claim to the insurance company. All other vaccines, if they coincide with a routine visit or a yearly visit, as we call it here in the States, then it's covered at 100%. The only catch is if we have to send your labs outside of Duke Student Health, then you will have a 20% responsibility. So it really depends on what you have during that routine visit. So some vaccines are covered, but for the most part, they're going to be included in your office visit. Okay.
Do we need to submit immunization record card and lab reports as proof since birth, since those info are already available on the signed immunization requirement form? If your immunization requirement form is complete and signed and stamped by your physician, that will be sufficient. If there is if there are other immunization records that you would like to submit along with that form, we will accept that as well and update your record and let you know if there's anything that you may be missing. And if you have any questions, you can email us at immunizations, immunizations at duke.edu, and we'll be able to respond to any questions that you may have. Which immunizations must I get from my country, and which ones can I get while at Duke? I am from Uganda. That's a very good question. The way I would answer that is please submit the immunization records that you do have and any immunizations that you're able to get in your own home country, and any immunizations that you're unable to receive in your home country you'll get when you arrive here at Duke. If you're a graduate student, it would be during International Student Orientation, and your program will let you know the date and time for you to arrive. Do health science students have to complete both the health science and undergraduate/graduate professional student immunization requirement forms? The answer is no. All we need you to do is to complete the health science immunization form, submit that with all your quantitative titers, and any other lab results, complete lab results, and once again, email them to immunizationrecords@dm.duke.edu prior to June 15th, and any immunizations that you need to catch up on, you can send them in after. Let's see, can I register courses before I complete TB tests? Yes. You have 30 days from the first day of school to meet that requirement, but we encourage you to get everything done prior to that so it doesn't interfere with move-in day and registration. I get the government funding and I'm still waiting for official documents. Therefore, I don't have my unique ID and student ID yet. How could I fill out my immunization form online in this case? In this case, please wait till you get your Duke unique ID and your net ID before you submit your immunization records. We will accept them, but they will be held aside until we get your Duke unique ID.
I cannot access Blue Cross and Blue Shield of North Carolina homepage so that I cannot check the detailed information on health insurance. Is it because I tried to access from outside the United States? I live in Korea right now. Most likely that is correct. You will most likely not be able to access the insurance web page outside of the US. What you can do is submit an email to insurance@studentaffairs.duke.edu and just type, hey, please send the detailed information of the insurance plan, and I'll send it in PDF format. If you need it in Word format, just let me know, because I know sometimes some people may not have they don't have the conversion. So whatever format you need it in, just let me know, and I'll be more than happy to go ahead and send that to you.
The next question is, I had a chest x-ray done in winter in USA. Can I save my imaging report from the center health records and send it to you, or should I ask the imaging center to arrange this? Also, I have an option to send the report from account to your email directly. We only accept TB screening performed in the US, and I see that you have that done. And chest x-rays must be no older than 12 months from the first day of school, which means no older than August 23rd, 2015. So we will accept that. I would recommend for you to get the report and then email it to immunizationrecords@dm.duke.edu. That way you have a copy in hand. I have actually finished the online form as well as other forms during my undergrad studies. The webpage confirms that I have completed the online form at year 2008. In such case, do I have to redo my forms, or is it okay if I leave as current status? If I have to, redo the process, please let me know the procedure. The online forms are closed for me. So I'm assuming that you are going to be a graduate/professional. I do have to let you know that all grad/professionals must have 2 tetanus, a TDAP, 2 MMR, and a TB screening. And even though you're a returning student, you still need to meet those requirements. I need you to please submit the TB screening form, which is the 3rd page on the required immunization forms. And also, we will be reaching out to you if there's any further immunization requirements, such as like a TDAP. Let's see. I am a graduate student and was born in 1991. Do I understand correctly that for the immunization requirements form, only first 2 rows should be filled? I mean tetanus, 1 TDAP, and MMR. As a graduate student, as I had stated before, all graduate students are required to have 2 tetanus, 1 TDAP, 2 MMR, and if I see that you were born in 1991, so you're not required to submit the hepatitis B series, but we also need your TB screening questionnaire. Please email that to immunizationrecords@dm.duke.edu prior to June 15th. As an international student, it is impossible for me to take either chest x-ray or TST or IGRA in the US facility within the due date. Is it okay if I take this test in Korea? Please let me know. So that's a very good question. Basically what's going to happen is I would encourage you to please submit all your immunization records prior to June 15th. We'll communicate with you with any other immunizations that you may need or any further TB testing that you'll need. Any TB testing needs to be performed here in the US, and you were correct. So when you come here to Duke, you'll have that done. If you're a graduate professional, it'll be during international student orientation, and your program will let you know what day and time. Let's see, as a practicing physician, I have documented immunity from a 1990 hepatitis B series. The records are missing from 1990. My physician does not want to subject me to another hepatitis B series. If I currently show documented immunity from the vaccine, please consider allowing me to submit my blood work documenting vaccines acquired immunity in lieu of vaccine dates from 1990. This is standard procedure for healthcare providers. That's a very good topic. And in reference to your question about the hepatitis B series, according to the North Carolina state law, it is required that all students show proof of 3 hepatitis B vaccinations, whether or not they have a positive titer. So in order for you to meet North Carolina and Duke immunization requirements, you must restart the series in order to meet our standards. Let's see. If I have my immunization records, can I drop them off at Student Health this week? We really would prefer that you email them to immunizationrecords@dm.duke.edu. That way you have a copy, and we'll be able to send you an email stating that we have received your immunizations, and please allow 3 to 4 weeks for processing. Do you have any requirements or recommendations for immunization of spouse/dependents? No, we don't require spouses or dependents to submit immunization records.
Also, just to piggyback on that, you may want to contact Duke Visa Services and ask them, are there any recommendation for spouses? Because we do not handle dependent coverage or immunization. So I would just go ahead and possibly just Google Duke Visa Services and email them that question regarding your spouse and immunization requirements.
In reference to Section C of the immunization requirements form, where would you advise the most incoming student with no medical records insurance in U.S. to get the test completed? Let's see, immunization requirements form. Okay, so since it looks like you're a U.S. citizen, I encourage all our incoming students to reach out to your high school, to your pediatrician's office, to your undergraduate universities, because a lot of them will still have your immunization records. And take those along with the required immunization forms to your physician or healthcare provider, and have them completed, signed, and stamped. You can email them to immunizationrecords@dm.duke.edu prior to June 15th. And then, I'm sorry, where's the other piece? And then in reference to the TB screenings questionnaire, that's what it looks like you're asking. In part, you have to answer section A. If you answer no to all the questions in section A, then you don't need any further TB testing. If you do answer any questions, yes to any questions in section A, then you will need further TB testing. And depending how you answer part B will determine what TB testing you'll need.
In China, we don't have a Tdap booster, so I have to come to Duke to get it done. Does the insurance cover the Tdap fee? Yes, Tdap is covered by the Duke Student Health Insurance. Is it free to take the hepatitis B? Hepatitis B is a covered benefit under the Duke Health Insurance Plan.
In China, we don't have TDAP booster, so I have to come to Duke to get it done. Does the insurance cover the TDAP fee?
Again, the Duke Student Health Insurance Plan does cover the TDAP fee.
In China,
Yeah.
okay.
Does the are PhD students who get monthly paychecks from departments, employees? I wonder if the PhD students get insurance coverage equivalent to Duke employees. That's something we're going to have to refer you back to Duke HR, because if you receive a paycheck from Duke payroll department, you're most likely classified as an employee. So in that situation, you would not be on the student insurance plan. Are PhD students who get monthly paychecks from departments equivalent to Duke employees? Well, just answer that. My apologies.
For some of my immunizations, the record indicates that month 00 year for the day. How should report the date in a paperwork, as the online form does not allow this date to be entered? So all immunizations need to be in month, day, year format. This is to help expedite your processing of your immunization records and also to ensure accuracy. If you have any further questions about this month, day, year, you can email us at immunizations@duke.edu. I am an incoming PhD student from China, and I got my health forms several days ago, but the doctors told me that I had the record that a bad fever occurred after injection of the hepatitis B vaccine. For this reason, they refused to give any injection or a vaccine to me. Is that the matter? Should I take the vaccine as required immediately, or can I get the injections in USA, or can I even get rid of the injections? Well, first, I wanted to remind you that any student that is born before July 1st, 1994 is not required to have the hepatitis B series. Second, we're going to need to schedule you an appointment to sit with one of our providers to address your hepatitis B, the possibility that you had a hepatitis B reaction. As an international student, I cannot fulfill all immunization requirements by June 15th. Do I have to specifically request for the extension, or does something else before this date? So, I've been hearing this question a lot, and what I can say is please submit your immunization records prior to June 15th, the best that you can. So submit what you have. And as you continue to work towards your immunization compliance or meeting our requirements, you can submit those immunizations as well to immunization records at dm.duke.edu. And any immunizations that you were not able to receive in your home country, you'll get when you come here to Duke.
Hi, it's Susan again. I'd like to just go back to the question about the fever after the hepatitis B. If somebody has a questionable reaction to a vaccine, we need supported documentation sent in by your physician. We will review the documentation, but the guidelines are very strict for actual anaphylactic reaction. So normally, the supporting documentation needs to show anaphylactic reaction. But we're happy to review it and let you know our findings. And you may also have an appointment, like Joy said, to come in to review as well.
What happens if I can't have a vaccine done in my home country, for example, MMR? Any immunizations that you're unable to receive in your home country, you'll get when you come here to Duke. For graduate professional students, it'll be during International Student Orientation, and your program will let you know the date and time. What happens if I can't have a vaccine done in my home country? Okay. Oh, it was a repeat question. Can PhD student get HPV vaccine for free when we arrive Duke, and does the insurance cover this?
The HPV vaccine is a covered benefit on the Duke insurance plan. I'm going to defer to Joy on the age. I'm thinking 26, but Joy is the expert in this in that age.
So if you've started the vaccine at home and then you come here, we will allow you to continue it. But once again, if you have any further questions about immunizations, you can email us at immunizations@duke.edu. These are all very good questions.
Yes.
If the contradiction certification of vaccine issued in China is invalid in North Carolina, will I be withdrawn from the university because the mandatory immunization requirement has not been met after 30 days over the beginning of classes? That's a very good question. And no, you will not be withdrawn from classes. What happens is once we have all your required documentation from your physician, what we will do is then review it, and if it'll be reviewed before a board of doctors, and that means that it's in process. So you are allowed to still attend classes as we review your documentation. How long does it take to get a reply from the Health Service Center after my submitted immunization forms? If you email your immunization forms to immunizationrecords@dm.duke.edu, you should get an instant response stating that it'll take 3 to 4 weeks for us to process your records. And in that time, we will communicate with you through secure messaging, which is in your Duke email. So please check your Duke email, and we will be communicating with you to let you know whether you've met your compliance or there's some other things that you need to have done. My health check is on tomorrow. I may not be able to finish all the vaccines before June 15th. What should I do in this case? So please submit all your immunization records that you do have prior to June 15th, and then any other immunizations that you receive after that time, please email them to immunizationrecords at dm.duke.edu, you'll get an instant response that will say, please allow 3 to 4 weeks for processing. And please make sure to check your secure messaging, which is in your Duke email.
In reference to Section C of immunization requirements form, where should you advise that most incoming students with no medical records or insurance in U.S. go get test complete? From the insurance perspective, Joy's going to have the final say on that, but I would assume it would be okay because your insurance is going to be valid as of August 1st. So you can probably, like Joy said, submit what you have, as of June 15th, whatever requirements that you have remaining. If you wait till August 15th when the student insurance is valid, then you can just come to Duke Student Health for the remaining immunizations or whatever testing you may need.
2 major questions. I actually finished my undergrad degree at Duke and subscribed my online health form back in year 2008. As I see my doctor, it says I have completed my online form at then. Do I have to redo the online form? That's a good question, and I'm going to ask you to please email that question to immunizations@duke.edu so I can get further details on that part. But in reference to your meeting the requirements, all incoming students, rather if they're returning or new students, they must submit a TB screening form. And then also we will be communicating with you if you're missing any other immunizations such as a TDAP, which was not required when you came in your undergrad.
Sorry. Hi, guys. As far as coming for vaccines at Student Health, there's just a couple of things I want to let you all know. So there's no walk-in clinics as far as immunizations go. We will have appointments, which you can call once you get to Duke. We also will have events such as international orientation for the graduate students. We will be giving vaccines out on those 2 of those days during orientation, which, like Joy said, you will be notified by your programs. We will also be making appointments at Student Health. Thanks.
Does the Duke insurance plan cover acupuncture? Acupuncture is a covered benefit on the Duke insurance plan. Just make sure that you go to in-network provider. You can actually visit the website www.bsnc.com/Duke and click on the resources tab, and it'll actually say find a doctor. So once you get here in the States, you could just put in your zip code. It'll give you all the in-network providers.
I am born in 1981. Do I need to get an hepatitis B injection at all? The answer is if you're a graduate/professional, you do not need to have the hepatitis B series. Can a doctor in the US fill up the immunization form in the basis of my immunization record, or does it have to be filled in my home country prior to arrival? So, as I've stated earlier, I really encourage all of our students to please submit your immunization records that you do have. So please go online and print out the forms and bring them to your physician with your immunization records and have them filled out and submit them to immunizationrecords@dm.duke.edu prior to June 15th. We will communicate with you if there's anything else that you may need. And as I've stated earlier, any immunizations or TB testing that you're not able to get in your home country, you will get when you arrive here at Duke.
If a student has current coverage from their home state provider, are they required to carry the Duke insurance plan? If a student is classified as an F1 or excuse me, if an international student is on an F1 or J1 visa, they are required to enroll in the Duke Student Health Insurance Plan. Can the Duke insurance be used in conjunction with the state Medicaid program? Yes, if you're enrolled in the Duke insurance plan, it can be used in conjunction with the state Medicaid program. Your Duke student health insurance will be the primary. So what that means is if you go to a provider outside of Duke student health, let's say you go to a specialist like a dermatologist, you're going to present your Duke insurance card as the primary, meaning the dermatologist will submit the claims to the Duke insurance first. And then if there is a remaining balance, that will be submitted to the state Medicaid insurance plan.
China entry/exit inspection and quarantine issued a contraindication certification of vaccination for me, which should keep me from the MMR and meningitis vaccine in both China and in America. Please submit all that supporting documentation that you had received from your physician back in China, along with all your immunization records to immunizationrecords@dm.duke.edu. And we will review them and communicate with you if there's anything else we need from you.
And at this time, I just want to let you know, once you get here to Duke and you have any questions in the middle of the semester regarding the insurance, or you're not clear how the process works, if you send an email to insurance@studentaffairs.duke.edu or contact your program coordinator and just let them know that you would like maybe a one-on-one, or if you have other students, other colleagues that have questions, then please don't hesitate to contact me, and then I'll be more than happy to come over to your location. If it's 2, 3, or 5 people, we can just sit down and we can go over any questions or concerns you have, or if you have any, if you ever receive a bill and you're not sure why you received that bill. So I just want to make sure you understand it. I know the U.S. insurance, it's kind of difficult to understand at times. I do it every day and I'm still get confused sometimes. So I don't expect you all to know this overnight. So if you have any questions, or you just, want to have a one-on-one or like a small group session, please contact me. Again, insurance@studentaffairs.duke.edu, or contact your program coordinator and let them know that you want to have a small group session, and that person will most likely email me, and then we can go ahead and get everything scheduled.
How late can I wait to get my vaccines? We really encourage you to get your vaccinations as soon as possible. The deadline for immunization submission is June 15th. Please submit your immunization records to immunizationrecords@dm.duke.edu. If there's any immunizations that you're unable to get before that deadline, please submit them as you get them to immunizationrecords@dm.duke.edu. And any immunizations that you're not able to receive as you're at home, you'll get when you arrive here at Duke. As Susan had stated earlier, we don't take walk-in clinic. You'll need to call and make an appointment, or if you're an international graduate student, you'll get the date and time at International Student Orientation.
Just so you know, immunizations are very serious in North Carolina, and we do have to submit reports to the state of North Carolina within 30 days of the start of school. So getting the immunizations started early is really the best thing, and submitting the records by June 15th. We will support you and get you all your vaccines that you can't get in your country once you get to Duke to help meet those state requirements. But we do need your help by not delaying getting the vaccines. Thank you.
Can you provide a brief overview of the services provided by your facility? I'm going to defer to Susan Kriskowski, our nurse manager, on that.
Hi, yes. So some of the services that we provide in student health include sick visits. We can do physicals. We supply travel clinics. So many of our students here will travel. We do allergy clinics. We have X-ray right now. We have a lot of psychiatric clinics, eating disorders, things like that. We work like kind of like an urgent care, and we also uh, have my chart appointments, so you'll be able to make your own appointments online. We have nurse practitioners, physician assistants, and physicians that can see you. Our hours are Monday through Friday, 8:30 to 5. During the school year, we're open on Saturdays from 9 to 1. Mm, thanks.
The question is immunization records at studentaffairs.duke.edu the correct email address to send immunization records to? Yes, that's another email address that you can use to submit your immunization records. So one of the questions that was sent in was, what happens if I miss the June 15th deadline? And basically, what ends up happening after June 15th is it just slows the processing and also delays us in being able to get to, respond to you quickly and what else you may need. So once again, I do encourage all of our students to please submit the immunization records you do have prior to June 15th. And then any immunizations you're not able to receive in your home country, we will work with you to get them here at Duke.
And we do start working with the registrars when we don't get records submitted, because often the registrars will help support us with getting the records submitted from students.
Another question students usually have regarding the Duke Health Insurance Plan is, do we provide coverage for international travel? International travel is covered on the Duke Student Insurance Plan at no additional cost. So if you decide to do research or study abroad for a semester and you're enrolled on the Duke Student Insurance Plan, there's no additional cost. Uh, and their contact information, we can provide detailed information on that. If you need it, you can email us at insurance@studentaffairs.duke.edu, or you could visit if possible, visit the Blue Cross and Blue Shield website at www.bcbsnc.com/Duke. Okay, I want to thank you for participating in this forum. You all had some great questions. If you come up with any additional questions, do not hesitate to email them to insurance@studentaffairs.duke.edu, and we'll go ahead and get those answered. And I just want to say congratulations and welcome to Duke.
And if you have any immunization questions, you can email us at immunizations, immunizations, @duke.edu.